Hello students, in continuation to the last video, we 202 module 6 GI pathology typhoid fever. In this video, I will discuss about the pathogenesis of typhoid fever. You have already known that the main causative agent behind the typhoid fever is Salmonella typhi, Salmonella paratyphi, Salmonella enterica, etc. The process by which bacteria infect our tissue, our immune system, is purely towards the GI system. As the bacteria is infected through food or contaminated water, it directly introduced within the GI tract. After entering within the duodenal surface, at the ileal mucosal layer, the primary combat with the body is initiated because in the ileal surface there is a presence of Pierce patch. Actually, Pierce patch is the macrophage tissue layer which provides the primary innate immunity system in our body. During the ingestion of food and during the absorption of food, the primary immunity response is developed at the Pierce patch region, but this is purely innate immunity. What is immunity? This is inborn. That means it is originally present after the birth. In the Pierce patch, macrophage first protect this bacterial surface against infection. But anyhow, bacteria can reduce the immunity response and invade the intestinal lymphatic node. From the lymphatic node, bacteria are multiplicated and enter within the mesenteric lymph node region. Through blood, spleen, and liver are continuously affected. Infection persists up to the gallbladder region, where bacteria again probe the surface of the gallbladder cells and re-enter within the GI tract. Thus, a cyclic event is continued for long period of time within our GI tract, blood circulation, and important enteric system. After entering of Salmonella typhi, the fast protection against bacteria develops within the Pierce patch region of ileal mucosal cells. At the junction between mucosa and submucosa, a lymph node is present. To food any bacteria, any pathogenic substances which are introduced within our body, first obstructed by this Pierce patch. Pierce patch is composed of macrophage. Macrophage is the phagocytic cell which is responsible for engulfment and phagocytosis and destruction of the foreign bacteria or pathogens. But anyhow, if bacteria can overcome This immunity response can invade the mesenteric lymph node through blood. It is introduced within the spleen, liver, and gallbladder regions. Therefore, any of the three regions, for example, spleen, liver, and gallbladder, may be infected by this bacterial infection. And after re-enter within the GI tract, a cyclic event or bacterial life cycle is completed. And again, bacteria, after destruction of the pathological surface, Pierce patch region, begin reinfect within the GI. Thus, a life cycle of pathogenic Salmonella typhi starts from ileal Pierce patch and again it completes in the Pierce patch. And within this transmission or transport process, mesenteric lymph node, blood, spleen, liver, gallbladder are equally infected. This is a summary of the infection pathogenesis. After ingestion of the contaminated food or water, Salmonella bacteria are introduced within the body, invade the small intestine, and enter the bloodstream. Here, small intestine means ileum surface, because Pierce patch are located within the ileal surface. Carried by white blood cells in the liver, spleen, and bone marrow, multiplication, re-enter the bloodstream again and again. Bacteria invade the gallbladder, biliary tract, lymphatic tissue of the bowel and multiply in high numbers. Then they pass into the intestinal tract and can be identified for diagnosis. And this is the crucial period for identification or diagnosis. Later, we will discuss about the diagnosis, which is very much important for typhoid fever. The main consequence of the diagnosis depends on the reinfection. Whenever the bacteria or bacterial particles or proteins can pass within the intestinal tract, these cells can be identified positive. Also, through stool test in laboratory, Salmonella bacteria can be identified. The main symptoms for typhoid fever is primarily no symptoms or asymptomatic condition. If only a mild exposure, some people become carriers of the typhoid fever. Otherwise, poor appetite, headache, generalized rashes, pain, fever, lethargy. Sometimes diarrhea may be observed. Sustained fever as high as 103 to 104 degrees Fahrenheit is very much important parameter or diagnostic feature. Critical symptoms develop when chest congestion develops in many patients. Abdominal pain, discomfortness, constipation, mild vomiting, slowness of the heartbeat can be observed. There are different stages of typhoid fever. Rose spot is one of the important significant symptoms called delayed typhoid fever response. In the second or third stage, rose spots are developed in the chest region. Simultaneous high fever, 103 to 104 degrees Fahrenheit, chest congestion are critical symptoms. In some of the patients, if typhoid fever are not treated with the antibiotics, can cause typhoid meningitis. In typhoid meningitis, bacteria can invade within the CSF or within the brain surface. The time frame of typhoid fever it consists of three stages: first stage, second stage, and third stage. It occurs after the pathogenic infection, bacterial infection, the bacteria. The first few weeks is the incubation period. In the first stage, the common features which are developed: high fever, fatigue, weakness, headache, sore throat, diarrhea, constipation, etc. Abdominal area, constipation, whereas the children can experience diarrhea confusion. First stage is not critical, but is the mild symptoms. In the second stage, typhoid fever is characterized by weight loss, high fever, severe diarrhea, or severe constipation. Again, severe diarrhea may be observed in children, whereas severe constipation can be developed in the adult condition. In the third stage, which is near critical stage, typhoid stage, if the typhoid fever is remains untreated for more than 2 or 3 weeks, individual may experience more deteriorous condition, unable to stand, or abdominal cramp or abdominal discomfortness, chest tightness are observed. So the pathogenesis and signs and symptoms of typhoid fever. In the next video, I will discuss about the diagnosis, which is very much important for typhoid fever.